As you all know, hospitals throughout the entire state of California have been struggling to keep the lights on and the doors open as it relates to not just the pandemic, but in many parts of rural California, these systematic problems that we have as it relates to Medi-Cal and Medicare reimbursement rates. The sense of urgency brings us to take a look at healthcare in our region, with one particular hospital at the verge of closing its doors because of financial uncertainties, and another hospital who, as of recently, has become put in a better financial situation due to reorganization and restructuring the types of services that they provide, giving them a much more stable financial situation. One of the concerns that we have with the second hospital is that in 2030, they have some seismic retrofit expectations that at the current moment, we do not have a financial path to finance those particular improvements. We also have an analysis that was done by an engineering firm for that particular hospital that says that the majority of the buildings that need to be seismically retrofit may need to just be reconstructed in its entirety. So we have one hospital that is 90% seismically retrofit. We have one hospital that doesn't have a clear path to meeting those requirements. The hospital that is seismically retrofit almost by 90% is in financial challenges, not only to keep the lights on, the doors open, meet payroll, but also meet its debt as it relates to the improvements that have been made due to state mandates. We've come up with the concept of consolidating healthcare districts to become more efficient and effective in the way that we're delivering services. There is a fundamental agreement in the region by most of the healthcare professionals, including those in these healthcare districts, that one healthcare district will bring about the efficiencies that are necessary to be able to ensure financial stability for the region. And there's also another fundamental agreement that by combining these two hospitals, integrating the services, and there's proof that when one hospital takes over certain services, it's helped them financially. In the case of Pioneers Memorial, they've taken on services that El Centro Regional Medical Center could no longer serve. It's helped them financially stabilize their situation. So the reorganization and the consolidation of programs has proven to create a better financial footing for one particular hospital. The purpose of the bill is to create one healthcare district, integrate the hospitals, create a governance structure that is reflective and representative of four corners of the county. There are two financial feasibility studies that are underway as we speak. We're asking that the governing body of this new healthcare district take a look at those analysis, determine if it is financially feasible to integrate the second hospital to create the one healthcare district. There's also one component here that perhaps makes some people uncomfortable, and that is the circumvention of a LAFCO process. As a former local government official who also understands the importance of local control, and coming up to Sacramento and fighting against Sacramento when every chance there was to take away that local control, we recognize that there are concerns about that, but the current circumstances, the urgency to keep these hospitals financially stable, and more importantly, to keep access to healthcare to the 180,000 people of Imperial County, not to mention the concerns that people in San Diego County have and Riverside County. If the one hospital closes, what does it do to their healthcare infrastructure? There's an urgency, and that's why the LAFCO circumvention is in this bill. I want to just stop there. We have our co-equal partner in this effort, Senator Steve Padilla, who also has some opening remarks as well.
Thank you very much. Senator.
Madam Chair and colleagues, I'm certainly happy to join the Assembly member with regard to AB 918. I want to thank the Assembly member for his incredible leadership and thoughtfulness in the face of an incredible crisis that I know you, Madam Chair, also personally and regionally very, very familiar with. Unfortunately, the communities of the Assembly member and I represent are at serious risk, as you know, of losing access to critical healthcare services, and this is already occurring in communities that are scarce of infrastructure for the delivery of healthcare services and other physical infrastructure which allows them access already, and this would further exacerbate that situation. As was cited, one hospital is on the verge of financial collapse, another is unable to retrofit. The creation of a countywide integrated structure will balance obligations, distribute risk, maximize financial feasibility. It also results potentially in cost savings, but at the end of the day, the most important outcome is to maintain an infrastructure for delivery of healthcare services. I want to say again that Assemblymember Garcia has been working tirelessly with stakeholders, members in the community. Often, as you well know, colleagues, these types of processes are not easy to accomplish in a positive end. I have a high level of confidence we can do this thanks to that leadership and yours, and I would respectfully ask for an aye vote.
The faster the integration occurs, as was mentioned earlier and quoted by the CEO of Pioneers at a board meeting in the county, it was that this integration will bring about cost savings for both hospitals under one system. At the same time, this integration of hospitals will trigger the ability for higher Medi-Cal, Medicare reimbursements, putting money on the table that currently isn't there, allowing us to look at the cost of retrofitting Pioneers Memorial Hospital, finishing the retrofitting, and paying the debt service at El Centro Regional Medical. So we are continuing to focus on those particular areas so that the mechanics of implementation of this ensure that care is at the forefront, financial stability of these hospitals is second to that, or right next to that, and that ultimately through cost savings and additional money being generated, we can also increase the level of access. Your question to federally qualified healthcare centers, they don't provide the same emergency response service that the hospitals do, right? They're providing primary care and in some cases some special type care. They are there. We have partnerships with Intercare, who is a supporter of the bill, one of the larger FQHCs there. And there are also medical doctors in the private sector. We have support from the Medical Society, which is the equivalent of the California Medical Association locally, in support of this effort because they also see that the financial outlook looks a lot more promising than what it does if we're operating separately. And so I hope that that answers your questions. And I can just attest to, we've had over a dozen meetings with stakeholders, including Pioneers, about wanting to accommodate to addressing those concerns. And one of the major concerns that they've had, and others as well, is how do we just put a hospital into a new healthcare system that brings not just assets, but major liabilities? We've developed a mechanism in the bill that it will be predicated on the fiscal analysis and the governing body that we've set up that's countywide to make that determination if it's financially feasible to integrate that hospital. So hopefully that answers the questions that you've just asked. I want to just send a message to the residents who called in, both in support and in opposition, and those who called into our office yesterday concerned about the bill, mostly members and employees of the Pioneers Memorial Hospital. They're under the impression that this bill will eliminate the hospital, dissolve the hospital. That's what their perception is of this bill. The bill will not eliminate the hospital. The bill is trying to save a hospital from closing to ensure that Pioneers Hospital doesn't take on the burden of those patients that will have to drive 25 miles north for emergency services. That's the one message that I want to send to the employees at Pioneers Memorial Healthcare District who called yesterday. The second is that what we're trying to accomplish here is efficiencies, economies of scale, and ultimately increase the access care to the residents of Imperial County. 180,000 people, 80% make up Medi-Cal, Medicare insured population. We have a challenge to keep these hospitals open. And so I want to just commit to Pioneers, to all of the stakeholders involved, that we will continue to engage and make sure that the bill is reflective of their concerns. One last point I want to make is that we took to heart the concerns of Pioneers when they said we're concerned about the dissolvement of our healthcare district at the signature of the governor, whether it be implemented with the emergency clause or January 2024. We've given a year plus of a runway to allow the healthcare districts to determine with LAFCO when they are prepared to begin the dissolvement in order to integrate into this new healthcare district. I think that's plenty of time to be able to coordinate what will hopefully be one healthcare district that will improve the quality of healthcare for the region. Respectfully ask for your aye vote.
Observing and partnering with the assembly members, a task and an honor. And invariably in issues with such urgency and complexity, you're going to have varying opinions from everyone you ask and every interest. And I'm happy with where the bill has progressed. I'll be jumping on formally and working it the balance in our House, and look forward to working with all of you. But at some point, the urgency and the delivery of care and the threat to that delivery has to be first and foremost, and that's what this bill does. And I thank the chair and my colleagues.